Good evening, good afternoon, good morning, depending where you are, everybody. Thanks for tuning in. My name's Simon Ramshaw. I'm the Managing Director of Erchonia Lasers Limited, which we are the distribution network for Erchonia Corporation in Europe, the Middle East and Africa. Thanks for tuning in tonight. Really appreciate your time. I've been looking forward to this talk for a while from Dr. Reis, who you can see in the corner there. Hi, Erik.
Hello.
His knowledge is unsurpassable, and the way he delivers it as well is in such a manner that he engages with pretty much every audience that he goes to, so that they get the knowledge, but they also get it in an entertaining way. So it's always a pleasure to have him on. Anybody who doesn't know Erik, you probably do because we've done webinars with him in the past. I'll give you just like a little bit of a descriptive of him. He's a doctor of chiropractic medicine and he's a board certified neurologist at the Neural Connection. He received his doctorate in chiropractic from Northwestern Health Science University, graduating with magna cum laude honors, and graduated from the University of Minnesota with his Bachelor of Science degree in kinesiology, exercise science with an emphasis on human motor performance in both athletic and therapeutic settings. Erik's one of these guys who thinks outside the box at absolutely everything. He's very entrepreneurial by spirit, and it won't surprise you to know Erik's also the co-founder and director of Health and Wellness at Nobody Studios, which is a high velocity venture studio focused on building 100 startup businesses in the next 5 years. So I think that pretty much demonstrates what sort of mentality Erik has, and he doesn't just accept the norm. He likes to push the boundaries. And rather than make your head too big, Erik, I think at this juncture, I'll tell everybody that obviously there's questions down the right-hand side. Feel free to fire a question at us throughout. Erik's happy to answer them as we go along. He can't see them, but I can, so I'll wait for an opportune moment to bring something in and let him answer. So please ask away. And on that note, Erik, very much looking forward to this, and over to you.
Thank you, Simon. I appreciate that. Always a pleasure to see you. We miss you dearly over here in the US now that we're over here, but it's always nice to catch up and see you on here. So thanks everybody for attending. Wherever you are in the world, I hope to bring some knowledge and clinical experience, and more importantly too, to help you empower yourself and your patients to understand really how to help the people that are coming into you clinically. And so whether you are in the aesthetics industry, whether you are a medical doctor, a chiropractor, massage therapist, a physio, to be honest with you, it doesn't really matter what type of provider you are, because you can benefit from the knowledge and information that we're going to be talking about today. And I think one of the main tenets of this presentation is really just helping people understand, like, what does the latest science and the latest research really tell us about how we can help people optimize their health and their overall health and wellness. And what I hope to provide today is a compelling argument that not only does this fully encompass why we're using low-level lasers and why Erchonia is the leader in this space, but more importantly too, why this is one of the best modalities and tools you can use in your clinic, not only from a patient outcome standpoint, but from building your practice, from creating receivables and billables for your office to stay open, to be able to provide those services for your patients. And more importantly too, why it's so amazing that we can do this in a non-invasive way. So there are my credentials. There are things for you to be able to take a look at to realize that I'm just a massive nerd hanging out in the world. But I have a question for you to start off, and I always start my lectures off with a question. I really want this to be a question that I want you to answer for yourself. Like, what do you think the future of healthcare should look like? Do you think it should look like it does today? Do you think that we should be trending in the same direction that we are trending currently with the cancer rates, the obesity rates, the neurodegenerative rates? I would argue that we are moving in the wrong direction. And unfortunately, even with all the modern technology, all the tools we're developing, all the new medications and therapies and procedures, we're still moving in the wrong direction. And unfortunately, what that means is that we have to think differently about how we're actually going to solve these massive problems that we're approaching and that we're finding on a daily basis with the patients that either come into your office or with the global rates that we're seeing trending in a negative fashion. And I'm going to cover each one of those specifically because I think it's important to give caveats, but clinical gems about how we can actually help our patients in the office who are dealing with this. I think this is a question that's on everyone's minds. Unfortunately, I'm not getting any younger. And I think for most of you out there too, you realize that aging just seems inevitable. But what does healthy aging actually look like? My grandmother is 93 years old and she lives on her own. She drives her own car. She still spends time with her sisters and they get to go to the casino and do their fun things on their Wednesday afternoons. Is that what healthy aging should look like? Why is she the exception, not the rule? Why are so many people feeling that aging is not only creeping up with them, but taking away all the things that they used to enjoy in their life? The latest kind of theories in aging and in longevity is that aging is no longer this inevitable jail sentence that we've been told. Can aging actually be stopped? Could it actually be reversed? If you talk to David Sinclair, who's a PhD researcher at Harvard, he's quite convinced that aging is a disease. And with a disease and a diagnostic as a disease, what does that mean? It actually means that we could potentially treat it. Now, it's an interesting thought process, and I don't think that we're fully there yet, but it begs the question of what does aging actually look like? Because if you take a look at this slide, here are the latest statistics about where we're at on a global state of health. Cardiovascular disease still takes out 1 in 3 people worldwide. And what we know about cardiovascular disease, for a majority of it, up to 90–95% of it, is that it's preventable. It's not something that you're born with or that your genetics sets you up for. And what's unfortunate about that is we've also seen massive increases in global spending on healthcare as well. It's more than doubled between 2000 and 2019. And I promise you, in the next 20 years, if we don't change the way we're doing things, it's going to double again and again and again. And especially for us in the United States, these numbers are quite staggering because these are situations where most people who are incurring medical debt are actually, that's the #1 reason for why people are filing for personal bankruptcy. This is a massive problem because not only are you dealing with a financial burden, but you still have this clinical health burden. The obesity statistics about global healthcare rates are staggering. 13% of the global population is now clinically obese. That's of 2016. That's 8 years ago. That's the latest estimates for the global stats. In 2024 today, in the United States, 50% of our population is either diabetic or pre-diabetic and clinically obese. That means 1 in 2 people walking down the street are dealing with a metabolic nightmare that is causing not only obesity, but an array of outcomes that we know are once again preventable. And sadly, here is what we know is that our population is living longer, but we're living longer with disease. So we might be living 5, 10, 15 years longer than we used to be 20, 30 years ago. But those last remaining years of life, the life quality, the quality of life is decreasing. Now, I don't know about you, but I don't want to live like that. And so we have to ask the question, like, what's going on? What can we do about this? Because the one thing that we know is that your chance of death goes up with age. And I say that in a bit of a cheeky way, but that's the truth, right? And we know that. The longer you live, the higher the chances that you have a few limited remaining days left. But what happens as well is the longer that we age, we also see increases in diseases, increases in cancer, heart disease, Alzheimer's. But here's where things get really interesting, is that when we take a look at modifying lifestyle factors, we know that there are things that can actually allow us to potentially live longer. In some of these early studies that are going on in longevity, they're looking at mice models. And there's a reason we study mice. They're relatively similar to humans with regards to the early stage research. Now, the gold standard will always be with humans and with clinical trials, double-blind, placebo-controlled, level 1 multivariate multi-site studies. But what's important for this is that they give us early indicators about potential options. And when we take mice and we restrict their caloric intake, what we see is we see an increase in their longevity and their lifespan. What's also interesting is when we start manipulating genetics and genetic expression, we also see increases in lifespan. Where things get interesting is with even some of the most standard medications we give patients, we also see changes in lifespan. Now, for those of you out there who know what metformin is one of the most commonly prescribed drugs for people who are type 2 diabetics. Well, why would that make sense? Is there something else going on there? What I'm going to tell you is yes, we still don't fully have it figured out, but things are a bit more complex than what meets the eye. Here is the one thing that we can take to the bank that we know for sure without a doubt is implicated in this longevity, this healing, this inflammaging kind of discussion, is that your mitochondria are at the heart of this entire discussion because they are the foundation for every single mechanism we're going to talk about today. They're the primary sites of ATP production. And that's what I was taught when I was in school 10, 15 years ago. Now we know they do far more than just produce ATP. We know that they're implicated with regulating inflammation. We know that they're really important for immune function. And when you see this cycle of mitochondrial dysfunction start to regulate and start to come out, what happens is that every single cell in your body becomes affected. We know that this is an important feature of the aging process. And I think what I believe at this point is not only are we looking into therapies that optimize mitochondria, but we're looking for therapies to give you more mitochondria, to upregulate the mitochondria that you have to be stronger, more resilient, to increase that bandwidth. And we know that they're implicated in multiple factors and in multiple pathways. And that's why you can't just say it's going to be one tool, one modality, one therapy, one fix for it with regards to what surgery or medications or even a supplement is. But what's beautiful about mitochondria is that they respond to photobiomodulation and laser modalities really effectively. And we're going to get into this a little bit later because what's amazing about this is that if we can increase mitochondrial function, we can increase longevity, we can increase health span, we can increase quality of life as well. And what's beautiful about this is that you don't have to just take my word for it. There's articles and papers and research that are lining up talking about the basis of aging with mitochondria, why mitochondria promote and they can regulate and they can decrease inflammation. What happens when mitochondria stick around for too long and become these senescent cells or these zombie cells as they would be looked at in the literature that are kind of like, the weakest chain in the link that are slowing processes down in the brain and body. This is a really important factor. And so if we're talking about mitochondria and we're looking into this model, what we really are understanding is the fact that inflammation is actually what's promoting aging. And we know that your mitochondria play a really important role in regulating not only the innate immune system, but all of the other properties that come with producing cellular energy, the recycling of different cellular nutrients, and on top of that too, how our immune systems function. Now we have to have a bit of a conversation about what inflammatory mediators and markers are actually being looked at in this space. I want you to write this down and imprint this in your brain, okay? These inflammatory markers will come up time and time and time again, not only in the lecture that I'm going to be giving today, but throughout all the clinical data and research that you're going to read about any sort of inflammation or inflammaging basis or methodology, okay? And we're looking at these factors called C-reactive protein, interleukin-6, and interleukin-1 beta, all right? We're also going to throw in there another caveat called tumor necrosis factor alpha. These are molecules that are pro-inflammatory, and time again, the research shows and justifies when these levels increase in the brain, in the body, or within the cell, you start seeing inflammation, you start seeing mitochondrial dysfunction, you start seeing essentially maladaptive processes that are going to negatively affect health. And we know that these pro-inflammatory mediators exist even in the absence of age-related diseases like cancer, cardiovascular disease, etc. There's an accelerated aging link between these processes and the activation or the chronic activation of your immune system. Because you need to activate your immune system in some way, shape, or form if you have a virus or you have a bacterial infection or you encounter some sort of pathogen. But it's the chronic, unenduring state of chronic inflammation that actually gets us. We know that elevated levels of interleukin-6 are used as a predictive marker for aging. Guess what some of the modern blood tests are testing for? Interleukin-6. We know interleukin-1 beta levels are also indicative of chronic inflammation and chronic activation of the immune system. Guess what some of the most modern blood tests are testing for? Interleukin-1 beta. We know that these are really important, and what they do is they actually dysregulate mitochondrial function. If your mitochondria are ground zero and foundational for your inflammaging complex, then you have to be looking at any sort of modality that's going to help you upregulate your mitochondria. But here's the kicker, right? This whole neurometabolic cascade of aging is a lot more complicated than it seems to be. Everyone's talking today about taking NAD plus or NAD plus precursors, okay? First and foremost, is that actually the best route to upregulate mitochondrial function? My colleague, Dr. Nicola Conlon, would argue otherwise, and I agree with her. NAD plus is a massive molecule, and your cells actually can't absorb it. So if you're doing NAD plus injections, or if you're taking NAD plus as a supplement, are you actually optimizing your mitochondrial function? You actually have to break down NAD plus to use it to go to NR-NMN, which is where the next phase of supplements started to move. But those are also molecules that are a bit difficult for your cells to absorb. Even if you do absorb those molecules, how can you guarantee that somebody's putting that into the cells that are needed for that to upregulate mitochondrial function? You can't. And this is where providers out there, and I'm sure that there are others out there outside of mine, who have had patients come to them with boxes of supplements saying, hey doc, why don't I feel better taking these? We know that it's not a silver bullet, and there's no single pill, procedure, or modality to treat aging. But what I'm going to tell you is that there is one that has very strong evidence and is being heavily looked at, and it's low-level laser. Now, ask yourself the question, if you haven't been to one of these seminars before, like, what is non-thermal low-level laser? Low-level laser is essentially concentrated light that instills billions of photons of energy into a cell. The focus is to upregulate and optimize cellular function. Plain and simple, the most basic foundational element of laser is upregulating cellular functionality. And this is really important for us. I really used to think that this light therapy, this low-level laser therapy, only affected the cytochrome C oxidase enzyme. And I'm going to debunk that really quickly, because some of the new research coming out is showing that different wavelengths of laser have different beneficial effects on different aspects of this electron transport chain. Now, this cytochrome C oxidase is the limiting enzyme in the electron transport chain in your mitochondria. And that's really important and really powerful, because when you upregulate that, what you do is you upregulate the production of ATP, which is needed for every cell and every aspect of your body. Now, your cell's powerhouse is your mitochondria. But once again, it's not just producing ATP. It's also regulating inflammation. And when I say regulating, it means that it can increase or decrease inflammation when appropriate or when not appropriate. We also know that your mitochondria regulate immune function. And when I say regulate, it means that it can increase or decrease immune function, whether or not it's appropriate. If I have a chronic infection, if I have a chronic cytomegalovirus or HSV virus in the background that's activating my immune system chronically over time, it's going to deplete my immune system. It's going to deplete my mitochondrial function, and I'm going to have massive outcomes as a consequence of that. Why are we using non-thermal low-level laser? It's a really good question. Here are the reasons why. Not only is it non-invasive, there's no downtime and there's no pain with it, but you have short treatment times. It can improve blood flow. It can obviously optimize mitochondrial function. It has anti-inflammatory properties. It has immune boosting and immune regulating properties. We're going to talk about how it's neuroprotective. It can augment and decrease stress responses in the brain. And what's really exciting about where Erchonia is up to is that we're using it now for non-invasive fat loss, which is really powerful. We can also enhance cellular repair. Now, if you were able to take this and bottle up into a pill, I promise you that this pill would be a blockbuster drug for the next millennia. Just like physical exercise. If you could bottle up physical exercise into a pill, it would be a blockbuster drug for the next millennia. Why? Because it has such far-reaching outcomes. And this is why, is because you're modifying and upregulating the electron transport chain. Now, in your mitochondria, you have the electron transport chain that has 4 different protein complexes, okay? Just think of it complex 1, 2, 3, 4. It's the easiest way to look at it. These complexes are all responsible for taking hydrogen ions and protons and pumping them through the electron transport chain to produce ATP at the end of the day. Now, we used to think that the red light on electron transport, the cytochrome C oxidase, that fourth complex, was the king, was the winner, right? But now what we know is that every single complex responds to a different wavelength, which is why it's so important for us to get every single wavelength, not only into our cells, but in a concentrated form to upregulate mitochondrial production. And this is what's exciting about what Erchonia is doing, is that with their violet light, we know that it primarily affects the first and second complexes. With the green laser and the green light coming, we know that it affects the third complex. And with the fourth complex, we know that the red light is there. So having that complex, that array of different wavelengths, is crucial, because here's what's interesting, is that second complex is really heavily implicated with patients who are on statin drugs. For any of you who are in clinical practice right now, it is quite common for you to encounter a patient with statin drugs because they have high cholesterol levels. Statin drugs can deplete this molecule called ubiquinone, or CoQ10. It's also really heavily needed and used for mitochondrial respiration through the electron transport chain. If you're only using one wavelength, let's say you're using the red wavelength in your office, and you're only upregulating the fourth complex, could you maybe be missing out on ATP production or ATP synthesis in that second complex if you're not using violet light? Probably. And here's the thing, we know the first and the third complexes are highly susceptible to aging, chronic conditions, and pharmacological drugs, which most patients walking into your door are going to be dealing with in some way, shape, or form. Most of the people out in the world today are in chronic states, whether it's chronic stress, whether it's chronic pain, whether it's chronic inflammation. And what's unfortunate about this is that we know pain is one of the biggest indicators and causes of physical disability. Chronic pain is going to affect at least 1 in 10 people throughout the world at some point in their life. And this is why I originally got on the board with Erchonia, was that they have 21 of the 24 FDA clearances for low-level laser. Their lasers are FDA cleared or FDA approved for low back pain, shoulder pain, neck pain, plantar fasciitis, postoperative surgical pain. I mean, the list goes on. And they also have 6 clearances in the fat loss and body contouring space. It's beautiful because they're all underlying in the same mechanism. And what's even more exciting is if you could use a non-invasive tool or therapy to help people get out of pain, we could tackle one of the most troubling epidemics of our generation, which is the opioid crisis. People are in pain more than they were 10, 15, 20 years ago. And unfortunately, what's happening is that pain is propagated by inflammation, chronic, unenduring inflammation. And what's beautiful about Erchonia's technology is that we can use a tool that's non-invasive, that has no downtime, is quick to find and achieve results, and we can help these people get out of that pain. But furthermore, when we start talking about the wavelengths, what's exciting for me is knowing that I can use different wavelengths to have different outcomes. I see patients with nerve issues all the time. That's what I built my practice on. And specifically, what we know is that there are differences between using laser and even using infrared. Now, both of those are photobiomodulation modalities, but laser is concentrated light, and infrared laser or infrared light isn't concentrated. It's also a little bit higher on the spectrum, where now you're absorbing more of that photobiomodulation, those photons, in the water than you are in activating the cellular mechanisms to actually upregulate cellular functionality. What we know is that different wavelengths can have different outcomes. And what's exciting for me is that this green laser actually has nerve regeneration outcomes. That's a really important factor for patients who have things like diabetic neuropathies. Well, how common is that? It's quite common because most patients who have diabetes will inevitably in some way, shape, or form develop some sort of diabetic neuropathy at some point in their life if it's not controlled or treated. They can also have different types of things like necrotizing outcomes or like inflammation in bed sores. They can develop all of these different outcomes when it all comes down to inflammation, and it all comes down to chronic immune activation. What we also know is that green low-level laser can stimulate different things like bone repair processes. Now, for me, you can't take it to the bank to say, well, you can just use green laser for osteoporosis, but could you accelerate the healing of a broken bone or healing of a tissue based off of this research? What I'm going to tell you is yes. Not only have I seen it clinically, but the research is there to justify it. Now, as we start looking into these trends, what's even scarier is not only what's happening from a structural or a pain standpoint, but from a cognitive and an emotional and a neurological standpoint. 55 million people worldwide have dementia. And sadly, these numbers are getting worse and worse and worse and worse over time. Depression is the leading cause of mental disability worldwide. And what scares me is that suicide is the 4th leading cause of death among 15 to 29-year-olds. That's scary. Sadly, what we know is mental health on a global level is getting worse and worse and worse. And here's why. Now, if we take a look at the brain, we're looking at this amazing organ. This thing weighs about 8 pounds, and it's responsible for every single activity and action that you're able to do. Go have a conversation with a cadaver that has all the muscles, all the tissues, all the organs, and a fully functional spine. And you're not going to get very far because the brain isn't intact. The brain is in this state where you no longer have a neurological integrity. But what does the brain actually do, and why is the brain important? Well, the brain might look like this on your table, but it actually looks like this. Now, this is a high resolution functional MRI. But what it's showing us is it's showing us these pathways, these super highways of information that travel back and forth. Your brain is essentially like my laptop. Your brain is a function of systems that are functioning together to provide you with the ability to speak and communicate and interact with your environment. And while that's amazing, what we know is that the brain is suspect and is susceptible to chronic inflammation. What we also know is that it's not just about the brain anymore. We know that there's a massive overlap between the gut and the brain and the gut. You have anywhere from 200 to 500 million neurons inside your enteric nervous system and your intestinal tract. Now, you might have 85 billion neurons in your entire central nervous system, but that's still a pretty high amount of neurons inside your intestinal tract. Maybe this puts it into perspective a bit, is that you have more neurons in your intestinal tract than you do in your entire spinal cord. Powerful. And what we now know is that chronic inflammation can alter your gut, which then leads to chronic inflammation altering your brain. What we also know is that injuries to the brain can also cause changes in gut functionality. I love this study, and for anyone who's listened to my lectures before, I've referenced this study every single time I speak because it's so powerful. In 2009, they published this in the Journal of Neurotrauma, and what they did is they caused a traumatic brain injury in rats. This was in a rat model. What they did is they took sagittal slices of the intestinal tract of those rats' digestive tracts, and here's what it looked like. The top photo is what a normal GI mucosa should look like, and within 6 hours, the bottom photo is what the rat's mucosal intestinal permeability tract looked like. You're essentially your castle walls that are responsible for keeping out bad bugs, bacteria, viruses, keeping you, secure from the environment, essentially opened up and let the floodgates in. Now that's a problem because that's where a lot of your immune system lives. Up to 70 to 80% of your immune system is found inside that gut-associated lymphatic tissue inside your intestinal tract. Well, here's an interesting caveat. The majority of your dopamine and serotonin is also produced in your intestinal tract as well. So when you're taking things like SSRIs, they're not just acting in the brain or the frontal lobe, they also have outcomes in the digestive tract. What we know is that if you negatively affect the gut, you're also negatively going to affect the brain. These tight junctions in your blood-brain barrier, these occluded and zonulin proteins that put together and hold cells together, are the same proteins that hold your blood-brain barrier together. They're the same proteins that hold your gut junctions together. And so when you compromise one, you compromise the other inevitably. And what we know is that this is actually the current model of neurodegeneration that we're applying today, is that we have neurological changes that are preceded by gut changes by 10, 15, even 20 years. This is what we're looking at for Alzheimer's, dementia, multiple sclerosis, Parkinson's, the list goes on. Now, that doesn't negate the fact that there could be overt trauma to the brain causing some of those neurodegenerative conditions. But here's the cycle that we see is we see these disruptions in these tight junctions and these barriers. And then over time, what do you think we see? We see inflammation. And take a look at the right side of the screen. Interleukin-1 beta, tumor necrosis factor alpha, interleukin-1 6. And at the center of all of that, you see, once again, mitochondrial dysfunction. You see it over and over again. And this is why it's so amazing for what Erchonia is building and what they're doing in the low-level laser space, is that we're noticing trends and seeing improvements and opportunities to help people who are in either neurodegenerative states or who are trending in that space. And they're applying these in very therapeutic ways. Now, Erchonia hasn't published a formal study showing that their lasers can delay or optimize or improve those symptoms. What I'm going to tell you as a provider is that I've been using this with my patients for over a decade. And I've seen interesting changes that I can't explain outside of the fact that I've been using this technology to help my patients. And it's not just my old patients, it's the young patients as well too. Looking at neurodevelopmental disorders and looking at kids with autism, kids with learning disabilities. The research is starting to pile up to justify and validate what we've known for decades in the clinic, is that light therapy can be very effective, especially utilizing proven technologies that not only have been cleared through the FDA, but are having beneficial outcomes for patients that haven't found solutions or options anywhere else. It comes as no surprise for any of you that not only are we in a chronic pain state, and mentally we are in a very difficult state as well from a mental health standpoint, but global obesity statistics are startling, all right? Worldwide obesity has tripled since 1975, all right? Just let that sit in for a second. I want you to comprehend how important that is. In 2024, more than 1 billion people are obese. That's 1 in 8 people worldwide. Not only is the United States leading that trend, unfortunately, but more importantly too, like, this has become a massive problem. Sadly, we know that obesity is the #1 reason for unenduring chronic inflammation. And what does chronic inflammation do to your mitochondria? It decreases their ability to produce ATP, regulate that inflammation, and optimize your immune function. We know that obesity is preventable. But why is obesity so bad? We've heard that having excessive fat is bad. People may not feel or look as good as they want to, but why is fat bad? Well, we know that excessive white fat is actually very pro-inflammatory, all right? Now, here's the caveat that I want you to be able to just really kind of sink your teeth into, is that fat isn't the enemy, okay? Chronic, unenduring, pro-inflammatory fat is the enemy, but you have fat cells for a reason. Your fat cells store toxins to protect you and to keep the toxins out of your bloodstream. Your fat cells are actually really important for producing hormones and regulating hormones. Your fat cells talk to neighboring fat cells. They send feedback to the hypothalamus. They send feedback to other areas of the brain and body. And so it's important to have fat and fat cells. That's why when you take fat cells away, not only is it really painful, not only does it have outcomes where you can promote more inflammation, but your fat cells come back. So it's not the fat cell that's the problem, it's the contents in the fat cell, and it's the functionality of that fat cell. And what we know is that white fat is pro-inflammatory. We know that a lot of these chronic disorders that we're dealing with are because of a chronic inflammatory problem, and white fat is one of the leading factors for that. Does anybody know the difference between white fat, which we look at as a negative bad fat, and the coveted brown fat that people are trying to acquire with cold plunges and different types of therapies and supplementation patterns? Does anybody know why brown fat is better than white fat? Here's what I'm going to tell you. Brown fat is brown because it has higher concentrations of mitochondria. So if you have brown fat and you have higher concentrations of mitochondria, what do you think is going to happen to your metabolic capacity in your profile? It's going to increase. It's going to be healthier. You're going to have less inflammation. You're going to be able to do more things. And here's why, is not all fat is created equally, okay? You can have lean adipose tissue, and everybody should have fat in some way, shape, or form. Females who have too little fat, who have conditions like anorexia or bulimia, what happens to them? Well, not only do they have wilting and withering of their skin and their collagenous, like their soft tissues, but they also have their hormones affected. They become amenorrheic, or they no longer have menstrual cycles. Well, it's very different than somebody who has way too much fat. This fat becomes very pro-inflammatory. And so you have to have a delicate balance of it, but your fat cells aren't the problem. It's the contents of what is inside that fat. And as you can tell, going from an anti-inflammatory fat to a pro-inflammatory fat cell, things look very different. And what are the patterns you see coming up time and time again? Tumor necrosis factor alpha, interleukin 6, interleukin 1 beta. The list goes on and on and on again. We also know that there's a link between your gut microbiome and insulin resistance. Studies have actually shown that lean and overweight rodents in humans They present differences in the composition of their intestinal flora. And what they're doing now is they're doing fecal transplants from healthy individuals into individuals who are unhealthy. And they're finding that those individuals who are unhealthy, who received a healthy flora, are actually showing beneficial metabolic markers because of that floral transplant. But the reverse is also true. Now, I know very few of you, if not none of you, are going to be doing that anytime soon, but the evidence is there. Now, correlations don't equal causations. But what I'm going to tell you is that the modalities of the future are going to help you not only upregulate cellular function, but they're going to be looking at gut function. And what regulates your gut function? Things that are in your food, in your diet, but also inflammation. We know that there's massive links between things like short chain fatty acids, keeping out lipopolysaccharides, which are gram-negative bacteria, and how they actually can promote insulin resistance. It's really important for us to understand too that there's not only metabolic factors, but there's neurological factors that are implicated with this. And every single person in the longevity space today is talking about the vagus nerve. Why the vagus nerve? Okay, the vagus nerve is your 10th cranial nerve, and it essentially affects and regulates everything from your throat all the way down to the bottom part of your belly button. It's important, but what's interesting is that 80% of your vagus nerve is sensory information going from the periphery in your body into the brain. Only 20% of your vagus nerves actually have motor capabilities and consequences. But here's what's interesting with this, is that your vagus nerve has several anti-inflammatory mechanisms that are currently being investigated about today. And they're looking about using vagal nerve stimulation for an array of conditions like rheumatoid arthritis, depression, anxiety, PTSD, concussions, brain injuries, cluster headaches. They're looking into it for obesity. They're looking into it for autoimmune conditions. Well, why would that make sense? Because it has an anti-inflammatory component. Your vagus nerve is also the yin for the yang of your stress response, your fight or flight response. So not only are you seeing decreases in your functionality from a neurological perspective, but there are three really important mechanisms from an anti-inflammatory standpoint. Now, I won't go into too much detail about this, but just know that the evidence is there. The evidence is still being investigated as well. But what's exciting about this is, why would we want to wait? If there are things there that we can do to upregulate vagal nerve function, then why wouldn't we go ahead and do it? Well, we are. And clinically, what I can tell you is that patients are responding very well to vagal nerve stimulation. But depending on how you go about it, that's an important factor for the outcomes. We know your vagus nerve, much like your mitochondria, is sensitive to these pro-inflammatory cytokines, interleukin-1 beta, interleukin-6, and tumor necrosis factor alpha. These are really important factors, but what we know is when you stimulate the vagus nerve, you can actually suppress and decrease the concentrations of those molecules. It's a yin and the yang kind of concentration and kind of feedback loop. Now, what we also know is that vagal nerve stimulation can improve your gut barrier integrity. Powerful. Well, that was the exact mechanism of what happened when those mice had the traumatic brain injuries, and all of a sudden their guts weren't functioning well. The vagal tone, or the vagus nerve function, was significantly affected because of a brain injury. Now, we know that that happens in mice. I've seen it happen in patients. But what's really interesting is that when you're proactive with stimulating the vagus nerve, you can actually prevent that intestinal dysfunction after traumatic brain injuries. Now, I'm going to just put a caveat. This is still in mouse models, but there's a reason that we study mice before we get into human trials. Now, on the left, that sham is exactly what your normal flora or mucosa should look like, right? You should have these thick castle walls with a bunch of villi, a large surface area for you to be able to have that exchange of nutrients and be really selective with what you allow into the bloodstream. After a traumatic brain injury is what that middle picture looks like. Your castle walls become damaged. But if you do vagal nerve stimulation and you induce the traumatic brain injury, that photo on the right is quite convincing. Now, you can't control or predict when someone's going to have an injury. Maybe it's a concussion playing football or hockey. Maybe it's a concussion while getting in a car, or maybe it's a concussion with you traveling on the tube in London. You never know. And so could you prevent some of these outcomes by stimulating the vagus nerve? I'm quite bullish on it. What's even more exciting to me is the fact that if you stimulate the vagus nerve, what they're finding is that stimulating the vagus nerve can improve autonomic function, quality of life scores, mood, and even sleep. And I'm aware of an organization today that is using vagal nerve stimulation to help special forces in the United States learn multiple languages 25% faster than they would be without it. Now, if that's not convincing enough for you, hopefully I can convince you with these next couple of photos. If you want to stimulate the vagus nerve, usually what they used to do is they would do surgery. And you can locate your vagus nerve around your carotid artery, either on the right or left side of your neck. Most of the time they're going to do it on the left side. Now, for those of you out there who want to stimulate your vagus nerve, I'm going to probably make the assumption that you don't want to have somebody go do surgery to do so, right? So here's what they would do traditionally for somebody who has medication resistant, like seizures or epilepsy. They'd go in, they'd put almost a vagal nerve stimulator around your carotid artery to wrap around that vagus nerve, and they would essentially put in a pacemaker style device for that. But I don't know about you, but I don't want anybody going into my neck, because my neck is not only very vulnerable, but that doesn't sound too fun. So what if you could do a modality to stimulate the vagus nerve in a non-invasive way? Here's the thing, you can. Calixto Machado did a phenomenal study where they used Erchonia's red and violet low-level laser, the EVRL, and they placed it over the left side of the neck for 10 minutes, okay, right over where that vagus nerve is exposed. Here's what they saw. They ran EEG studies. So they ran a quantitative EEG study and looked at the changes in brain function following this low-level laser modality. And it's quite convincing to see the outcomes, right? So you can see, based off of where they started to where they ended up, there's a significant change in brain function, and they did it over and over and over again. Now, what's beautiful about that is that we know that the red and blue light together will stimulate your parasympathetic nervous system. And while that's powerful and that's exciting, this can have far-reaching consequences. So if you're sitting at home today and you have a laser, or you plan on getting a laser, or you don't have a laser, how can you stimulate your vagus nerve? Well, my go-to default in the office is using low-level laser because, one, the research is there, but two, it's an effective modality to put a patient on, walk away, and continue to see other patients while doing so. But I also give patients things like belly breathing. I give them humming. I give them singing. I can do different modalities to try and stimulate the vagus nerve, and those are all powerful, especially when they're paired together. Because if your vagus nerve can control inflammation, then there is an interesting correlation there with controlling vagal tone and potentially altering inflammation. Now, what's interesting with some of the data coming out is that we know that there is a significant link between mental health and inflammation, okay? Individuals who have mental health issues, statistically speaking, have higher levels of these pro-inflammatory cytokines, interleukins 1-6, tumor necrosis factor alpha, and interleukin 1 beta. Where is ground zero for controlling inflammation in the brain and body is my question to you. And we already discussed it. It's the gut. It's looking at the gut and optimizing the gut for functionality. Because time and time again, research paper after research paper continues to show that inflammation plays a role not only in mental health issues, anxiety, depression, and PTSD. We've seen it time and time again. And we see these pro-inflammatory mediators continue to come up time after time again in these outcomes. And what's unfortunate is that if you're depressed, you're most likely inflamed. And if you're inflamed, you're most likely going to end up becoming either depressed or dealing with mental health issues. It's a two-way street. And sadly, it's a chicken or egg conversation. Which one should come first, or which one does come first? Well, sadly, we don't always know, and you don't get to sign up for that. But we know what inflammation does to the brain is it has massive, massive outcomes for you, not only promoting neurogenesis, the formation of new neurons in your hippocampus, but it affects your ability to form new synapses, your neuroplastic or neuroplasticity pathways. Now, these are really important for us, and every single one of these papers, time and time again, comes back to the same pro-inflammatory mediators. And we know that your gut is found zero because we know that food has a significant effect on your production of inflammation and how your insulin spikes. Now, what's really interesting about this is everyone's talking about GLP-1 agonists. They're talking about semaglutide, Wegovy, right? And everyone is looking at this as like a panacea for weight loss. But here's the problem with that, is 50% of the weight loss that you have on those medications is fat. The other 50% is lean muscle mass, the most coveted real estate that you could ever want or have for your body. Why? Because lean muscle mass is very metabolically active. It's important for us to have lean masses. That's one of the biggest factors for looking at quality of life and longevity. We know that GLP-1 works on a neurological and a metabolic capacity. We know that it suppresses your appetite by acting on the hypothalamus. via the vagus nerve. So what does that mean? You have to have an intact vagus nerve to actually see the benefits and outcomes from GLP-1 agonists. Now, every single person on this call and every single person in the world produces GLP-1 already in their body. It's a gut peptide that you already produce. What they've found is that higher concentrations of this, especially in the medications that are weekly doses, what they do is they act in a long-term sustained fashion because it's broken down really quickly by enzymes in the gut. We know that it delays gastric emptying, which means that the food in your gut is sent into your small intestinal tract at a slower rate, so it doesn't spike your blood sugar as quickly. Now, it's really important, and there's a lot of beneficial things that can come from these. But what we know is that even if you're using GLP-1s and you're losing weight, if you're not upregulating mitochondrial function, you might look better physically, but you may not metabolically be better off. You may still be having chronic inflammation, chronic activation of your immune system, and depression of your mitochondrial function because of the foods you're eating, the lifestyle you're living, and maybe just the lack of exercise that you're actually getting. What's beautiful about Erchonia and what they've done with their studies and their research is that they've actually looked into some of this about how do you not only get people to lose weight, but how can you actually upregulate mitochondrial function? Well, by using low-level laser, you're automatically going to upregulate mitochondrial function. And by losing weight, you're going to have the yin and the yang, both of those pathways upregulated. They are the first company to get FDA clearance for a 30 to 40 BMI in their weight loss and body contouring space. What's beautiful about this is that this study was performed on people where there was no dietary changes and no exercise allowed. And 73% of the patients involved in this study lost an average of 6 inches in 6 weeks. Now, I don't know about you, but that's pretty convincing. What's beautiful about that too is that they didn't get rid of the fat cell. The laser creates a transitatory pore that essentially opens up and allows fat cells and free fatty acids to flow into the lymphatics. Well, the first question is that you should ask is, where does those free fatty acids go? They get absorbed by the lymphatics, they get drained out by the liver and through different matters to get rid of bodily toxins. And you essentially not only see an enzymatic or metabolic process, but you see fat reduction while also maintaining the integrity of the fat cell. So not only do you have a non-invasive therapy, but more importantly too, you essentially see the melting of those fat cells. I think this is probably one of my favorite videos that I post is because it really gives you a real kind of emotional reaction to what actually happens to those fat cells. We didn't get rid of any of the fat cells. What we got rid of is the contents of those fat cells. And then those free fatty acids were either absorbed and used, or they got rid of through the lymphatics and throughout the bowels and the rest of your detoxification pathways. It's a beautiful process. And when you compare it to other modalities in the space, what you realize is that the emerald laser is second to none. And the outcomes speak for themselves. These are pre and post findings of the same patient. I think these are usually about 4 or 6 weeks between the photos taken. Time after time again, not only do you see changes in the fat cell circumference, but you see changes in the body. You see changes in the way that people are holding on to their fat. What's exciting to me as a provider is that not only are these patients looking better, but a lot of them are feeling better too. They're reporting, hey doc, I'm sleeping better. Or hey, I've been having a lot of issues with pain. And even though you haven't been putting laser over my low back, my back's feeling better. Or maybe I have less tension in my shoulders. And time after again, what we're noticing is that these people are having systemic cellular effects. Well, why would that make sense? It's because these lasers are upregulating cellular functionality via the mitochondria. We know that fat cells produce hormones. And when you get rid of fat cells, you could alter the metabolic and endocrine functionality. This white adipose tissue secretes a number of pro-inflammatory mediators. And so when you get rid of that excessive amount of fat, you can change the metabolic profile and capacity of these patients. Well, I have providers right now who are running metabolic lab panels on their patients before they put them on the emerald. And what they're finding is that they're finding things like changing in fasting glucose levels, changing in cholesterol, changing in inflammatory markers are actually improving. Now, I can't guarantee that and take that to the bank for every single patient in your office, but I think it's exciting, especially when you're pairing it together with other modalities like nutritional counseling, getting them to exercise, living a healthier lifestyle. These are all important factors. We also know that different wavelengths are going to impact different components, and the green low-level laser actually impacts adipose-derived stem cell production, which means that you can also see increased mitochondrial function and activity as well. So ask yourself the question, why non-thermal low-level laser? It's because of every single one of these things that I've previously just talked about. Now, I want to end with just a really quick crash course on longevity and aging and what the latest research actually looks like, okay? Because not only do you have an amazing tool via your low-level laser, whether you have one or you plan on getting one, but more importantly too, there are other things for you to augment the functionality and mitochondrial functionality of your patients in front of you. Every single provider on this call today is receptor-based. And what I mean by that is that regardless if you're giving medications, supplements, using modalities, you're doing therapies, using light, sound, smell, you are affecting the brains and the bodies of your patients in some way, shape, or form. I'm affecting you in some way, shape, or form, for better, hopefully not for worse, by having this interaction and communication and teaching you things. And so we have to really understand the magnitude of how impactful these therapies can be. Receptors are what change the outcomes for patients. But I have a question for you. How can you actually optimize longevity and healthy aging? We've already touched on an extensive amount of how you can use low-level lasers to do that, but there are other ways for you to help your patients live a healthier life. And the first one we already briefly touched on. Caloric restriction can actually help upregulate longevity. Now, in mice models, we've shown that this can happen time and time again. In human models, these trials are still being done, but the outcomes are looking quite promising. And what we know is that caloric restriction can enhance multiple metabolic and hormonal factors, specifically looking into metabolic alterations, cancers, and other causes of mortality and disability. We're looking at cardiovascular disease, type 2 diabetes, hypertension. We're looking at neurodegenerative processes. It's exciting. And it's literally just because you're eating less and you're helping your cells not be so overwhelmed with the amount of calories and nutrients you're putting into your body. Let alone the fact that if you're eating foods that are calorie dense but nutrient deficient, you're going to need to eat more calories to get the same amount of nutrients as if you would if you're eating a normal, healthy diet. We know that intermittent fasting can have a pretty significant role in allowing your brain and body to take out the day's trash. By fasting, you essentially allow your brain and body to take inventory about what cells they want to keep around and what they don't. And you can get rid of the old, slow cells that are slowing you down, these senescent cells. It's essentially a way to not only dampen inflammation, but get rid of old cells that are no longer servicing you well. We also know that periodic fasting can promote different stem cell regeneration in different areas of the gut and different areas of the body. What's exciting about that is we also know it can have complications for your brain and your central nervous system. This upregulation of autophagy or mitophagy. Autophagy is just the getting rid and recycling of old cells. Mitophagy is specifically that same process from mitochondria. We know that the upregulation of this pathway might actually be neuroprotective. And it is actually something that's being investigated for drugs that can cross the blood-brain barrier. Well, of course it is, right? It's the most tightly regulated barrier in your body. You can't underestimate the power of physical movements and exercise in the discussion when we're talking about longevity. What's important for this is to understand that movement really is the language of the brain. And time again, research continues to justify and show how the impacts of exercise and how important they are for not only brain health, but metabolic health. We know that activation of your muscles is a really important factor for keeping your brain young. And that's why when astronauts go to space, they can't stay for very long. Is because they're no longer fighting gravity, they're no longer using their muscles and joints as much, so they have to exercise for 2, 3, 4 hours a day to try and keep their neurological integrity. We know that the stimulation in the metabolic factors coming from exercise have massive implications for controlling inflammation and optimizing immune function. And we can't underestimate the capacity and the power of how important sleep is for optimizing longevity and quality of life for your patients. If your patients aren't sleeping well, or if you're not sleeping well, you are more prone to inflammation, chronic disease, immune dysfunction, and nearly every single chronic condition that we know to man and woman. What's powerful about this is when we get people sleeping better, when we get people increasing their capacity to sleep better, we see benefits all throughout the brain and body. We see increases in memory, increases in energy storages, increases in cellular regeneration. The list literally goes on and on and on. And we know it's a really important factor. If you want to take away just a one-pager, one sheet of essentially what you can do for yourself or for your patients to have the anti-neuroinflammaging practices, this is the screenshot for it. And of course, number one on there is non-invasive low-level laser therapy. I use my laser off-label from what Erchonia has their FDA clearances on because I'm using it clinically to try and solve problems for my patients. I don't want to wait for the research. Now, I think the research is important, but the mechanisms are already there. I'm seeing clinical trials and studies being done because doctors are taking a leap with trying to help patients, and they inform the pilot studies, the case studies, and then the peer-reviewed studies that follow that. But you can't underestimate the power of modifying lifestyles. Intermittent fasting, physical exercise, optimizing sleep, exposing yourself to extremes of weather, using stress relieving techniques, and always, of course, using food, nutrition, and if needed, supplementation. These are all really important factors. And what I want to ask you for the final thing is, why non-thermal low-level laser? It's because it covers every single one of the facets that I've talked about from an inflammation and an anti-aging standpoint. So if you're somebody who has a laser and you understand the mechanisms here, great. You can use this with every patient that walks into your door, and you should be, because I am, and I know a lot of doctors out there already are. But if you're somebody who's maybe looking to dip their toe in the water, I think you should have some conversations. I think you should be looking at the research and the data, because I promise you, this is the early stage of the next wave of helping people optimize their structural, neurological, and metabolic health. And laser is one of the best modalities out there to do that. So I hope you were able to take something away from this. For those of you who have any questions or want to reach out, here's the contact information for Simon. Simon obviously is somebody who will be able to sort you out and get you more information. I will be sharing these slides in the slide deck after the presentation today, and I know Simon and his team will be sharing that as well too. So I want to thank everybody for joining me today, and hopefully you're able to take some key takeaways away to help you live a better life and help your patients live a better life too. So thank you.
Brilliant, thanks, Eric. There's a couple of questions that have come in privately to me on WhatsApp. And just to reiterate what you said and what we're hearing so many times at the minute with regard to the importance of the mitochondria, just about every lecture that we do or every event that we go, there's new research that's coming out, and we're actually looking to do some more research ourselves on it. But, you know, I think, you know, we all have everything we need to live a healthy, good life, especially when we're younger, but these bad lifestyle choices mean that our bodies don't perform at the levels that they can perform at. So if we can help in some way by making the mitochondria in patients' bodies more viable, then, you know, it can only be a good thing, right?
Correct. 100%.
Okay, first question. Can you repeat what sort of effect non-thermal laser can have on brown fat?
So I don't know if the research has shown a specific effect on brown fat, right? We all have a small amount of brown fat in our bodies. The main focus of that is that everyone is going after and trying to find ways to increase brown fat, like little babies, like little kids have so much more brown fat than we do. And you lose that over time. The whole focus of that is that the reason brown fat is so coveted is because of the high concentrations of mitochondria in the brown fat. Not only is brown fat more metabolically active, and so therefore it'll keep you healthier, but on top of that too, the appearance of brown fat is brown because of the concentration of mitochondria. So what I'm saying essentially is that if you want to upregulate cellular function, the low-level laser will do that, especially if you're using all three of those wavelengths, because they all affect 1, 2, 3, 4 electron transport chains in the mitochondria. The brown fat focus is essentially saying, listen, we all wish we could be young and healthy and be essentially a child or an adult in a child's body because of the brown fat that they covet. I don't know if I can necessarily say that I've seen research on brown fat and laser, but what I can tell you is that laser can upregulate mitochondrial function, much like brown fat has a higher concentration and functionality of mitochondria. I hope that makes sense for that.
Yeah, no, that does. It does to me. Thank you for that. Can this work on visceral fat?
I mean, it can. It depends on what laser you have, right? So if you're using the emerald and you're doing, modalities with the emerald, you're obviously going to have fat outcomes based off of that. subcutaneous versus visceral fat is very different. And we know that the visceral fat is far scarier or far more lethal from a longevity and health quality standpoint than it is the subcutaneous fat. When you start losing fat, it's not like you're just going to lose fat in your biceps or like on like wherever the laser is going to be. Erchonia has done the studies, and they've actually shown that even when you're using the Emerald like over the glutes or over the chest or over the stomach, you actually see decreases in the circumference of other areas of the body because you're having a global cellular effect. And so what I would say to you is that if somebody has high concentrations of visceral fat, they probably have high concentrations of subcutaneous fat. Well, what do you do for that? You want to maintain the fat cells, but get rid of that pro-inflammatory white adipose tissue that I was mentioning and talking about. So yes, it's going to have an implication or an outcome in some way, shape, or form. You just have to figure out how to help that patient in any capacity possible, because that visceral fat is really a massive problem for a lot of people, and it is relatively hard to get rid of if you're not doing all the things that we had mentioned.
And again, it's something that I've been in discussions in the last couple of weeks about doing some research with a plastic surgeon in the UK looking at visceral fat. And it's important to state that all Erchonia's research is on subcutaneous fat. They've got, I think, 7 different studies which have been carried out with the red laser and the green laser.
Yep.
But a lot of the clinics that we have on board, I know in Europe and the Middle East, I'm not sure about the US, they do their BMI indicators, so the body mass analyzers. And we've received so much data back saying that visceral fat has actually reduced during a course of Emerald treatment, which we're not surprised about because theoretically we know it can work on it. It's just being a US company, we can't obviously promote that because we don't have an FDA clearance for that.
Correct. And I can talk about that as a clinician and as a provider. The data starts with the providers who are on the ground, bootstrapping and working directly with patients. Once that becomes a correlation or something that we see as a pattern, then it gets written up as a case study and it gets published. When there's enough case studies justifying it, then we start doing early stage pilot studies. And then once those pilot studies go through, then we start doing the double-blind, multi-site, multivariable, grade 1 placebo-controlled studies that Erchonia has done so well. And so while it's early and we don't have the study fully done or fully published, you're seeing things clinically that are quite remarkable. And those inform later studies. And so none of that surprises me from a clinical standpoint. It's just, as Simon said, we have to be careful saying, that Erchonia stands by this because they can't say anything without the research backing it up. As a provider, I've seen those outcomes, and I know a lot of the clinics that we've spoken to have seen those outcomes as well too. So it's pretty exciting for those patients.
Definitely. Another question, we've seen reports with the likes of cryolipolysis treatments that it causes paradoxical adipose hyperplasia. Are there any known side effects or adverse reactions with non-thermal laser?
There are not, no. You're gonna get those, the hyperplasia, and even with like you taking a look at like liposuction, don't forget that your fat cells are heavily innervated by vasculature. So it's quite a bloody, quite an invasive procedure. But on top of that as well too, is there's a ton of nerve fibers that go in there. These small C delta fibers that propagate pain. Anybody who gets, those types of invasive procedures, not only are you ripping up arterial and vasculature highways, you're damaging different aspects of the connective tissue, which is why you get the hyperplasia. You're damaging neurons, which is really important. And some people will get numbness, tingling, or paresthesias and things like that as a result of it. And the best part about Emerald and Erchonia is that this is a non-invasive procedure where you are literally not only upregulating cellular mitochondrial function, but you're also decreasing the concentration of fat inside those cells. It's one of the coolest modalities. And every time I watch that video, I continue to be amazed by the fact that we even captured that on camera, but that it's an actual mechanism that we've found. There's just nothing else like it in the world.
No, I agree. And you've known the lasers for quite a long time. It's something that we like to educate on because this side of the pond, there does seem to be a lack of education on low-level laser, with a lot thinking that it's just the one type of modality and not realizing that, infrared that fall into that, which you alluded to earlier, and non-thermal laser diode. But even though they come under the same umbrella, they're like day and night by way of the way they work, with one being photochemical and one being photothermal. So, I don't know if anybody who is on this actually realizes and understands that it takes a specific amount of electron volts per photon to create a photochemical reaction. And that's proven to only happen with invisible light. Anything above 700 nanometers, when you start getting into the infrared part of the electromagnetic energy spectrum, they deliver more photons, but the photons are less energetic. So they're unable to create this photochemical response. So what happens? The energy goes into the body. It can't create the photochemical reaction. So when it comes into contact with the water molecules, it makes them vibrate and it turns them to heat. So that's the big difference between the photothermal and photochemical, being more like, you know, a pharmaceutical drug, working at a biological level on the inside out, but without the side effects or adverse reactions. So I just wanted to finish off by saying that. Erik, as normal, you know, you're a world of knowledge, and thank you very much for sharing it. And thank you very much for your time, and we look forward to having you back.
Yep, thanks, Simon. I appreciate you having me. Thank you.
If anybody else has any questions, let us know. One of the team will actually send a copy or recording of this to you. So anything from that, just fire away the questions, and if I can answer them, I will, or if obviously we've got to put it across to Erik, we'll do that as well. So again, thanks everybody else for tuning in, much appreciated, and we look forward to welcoming you back on our next event. Just to put it out there quickly before we leave, on Saturday, the 1st of June, we have Dr. Dan Murphy coming across from the US, again, talking about the longevity, health and wellness side of things, and Dan's very knowledgeable on that. And on the 29th of June in London, we've got Dr. Rob Silverman coming over from New York, who again will be talking with a high, you know, a high input on mitochondrial function. And also Dr. Nicola Conlon will be appearing within that. She'll be talking about the Nuchido products, the increase in NAD+, and how they work compatibly well with the laser. So you should receive invites to that. If you haven't or would like more information, please just reply to the email that my team will send, and we hopefully look forward to seeing you there. So thanks again, everybody. Erik, thanks very much, and
thank you.
I will let you get back to whatever you were doing.